Hello, and welcome to the 2015 Respiratory Protection Program for the Boone County Fire Protection District of Missouri Task Force 1. Under an OSHA 1910-134 Respiratory Protection Program, the specific elements are proper selection, medical evaluation, fit testing, use, maintenance and care, breathing air quality and use, training, and program evaluation. In that program, the organization must define the environments in which they can anticipate sending you into, and then select the appropriate respiratory protection to provide you with. They've got to be constantly updating that program to look at the different mission parameters in which you might be sent. With that, then they can determine the proper respiratory protection that you might need, as well as what changes they might have to their program to provide you with the proper protection. There should be a qualified administrator that's going to look at the program, make sure you're getting the right training, and they have experience to administer or oversee the program. And the organization must provide the respirators, training, and medical evaluation to make sure that you're getting the proper fit, the proper equipment, and that you're fit to do the job. The organization should initially try to engineer controls to keep you away from those environments. Things like ventilation, isolation from the contaminants, but in the areas where they can't keep you away from it, they have to allow you the ability then to go in and do your job. They've got to look at feasible ways in which they can provide you with the right respiratory protection. This usually involves respirators, and they're the different types that would provide for your protection, your respiratory protection in those environments. One of which is the air purifying respirator. This is a respirator either full face or half face with a cartridge, canister, or filter applied to it. With that then, that filter material, as you inhale, draws the air, ambient air, through the material, capturing those particles in on that filter material. With a negative pressure respirator, as you inhale, you create that negative pressure. That negative pressure then draws ambient air through and captures the particles onto the filter material. A simple dust mask, or an N95 mask, as we quite often use with the Fire Protection District, again utilizes that negative pressure to draw the particulates in. Without that, those particulates then would enter through your nose or mouth and directly into your respiratory tract. With a powered air purifying respirator, or PAPR, this is an air purifying respirator that uses a blower to force the ambient air through the air purifying elements and directly into the inlet covering of either the facepiece or the hood, depending upon the unit that's used. With the Missouri Task Force 1, we have PAPRs that are part of our hazmat atmosphere supplying respirators. These are respirators that provide you with breathing air independent of the atmosphere in which you're in. These include really two different types. Either a self-contained breathing apparatus that allows the user to carry their breathing air with them. The other would be the SAR, supplied air respirator. This is where you'd have a full-face SCBA with a regulator attached to it that runs back to a supplied air system from either a cascade system or from a air compressor anywhere from up to 300 feet away from you. You have to select the proper respiratory protection for the environment in which you're in. First, you should look at any kind of respirator that you utilize should have a NIOSH certification on it. Be it a dust mask, N95, or even the adapters that go on our full face SCBA face pieces. Those respirators, those filter materials, need to be certified for the jobs that they're doing. You need to make sure that you're using the right filter for the environment in which you're in. And any time that you can't identify what the environment is, you should automatically assume that it's immediately dangerous to life and health. Select the respirators on the specific types and models and sizes are provided for you. Not one size fits all for the higher end respirators that we have. So even with an N95, they're small and large. With our full face SCBA face pieces with the adapters and cartridges on them, those again are size, small, medium, large. So make sure that you've got the right equipment for the environments that you're going to go into. When you think about classes of the particulate filters that we have, their use is determined by the atmosphere in which you're going into. Is it oil present in the atmosphere, or is there not? There are 9 classes of filters, 3 levels of filter efficiency, each with 3 categories of resistance to filter efficiency degradation. The levels include 95, 99, and 100%. The categories of resistance to filter efficiency are N, R, and P. When we look at N, R, and P, it depends upon the presence or absence thereof of oil particulates in the air. If there are no oil particles present, then you can use any of them, N, R, or P. If there's oil particulates present, then you can only use an R or a P. If oil particulates are present, and the filter to be used for more than one work shift, then only use a P. Remember, N is not resistant to oil. Our N95 masks, when we're going into a infectious disease environment. R, it's resistant to oil. We know that there are oil particles out there, and we're going to go in for one work shift or a shorter work shift. And P is oil proof. Anytime that we're going to go in an environment to where we know there are potentials for oil particles in the air, we go with a P100. And again, our efficiencies are rated in 95, 99, and it says 99.97%, but it's classified as a 100. The filter materials are designed to capture certain sizes and certain types of particulate matter. You've got to make sure that when we're looking at this, that we're using the proper canisters for the jobs. With this, either on our full face SCBA with an adapter, the half face, or the N95 masks, we've got to make sure that we're using the right one to allow air to pass through those filter systems and directly to allow us to breathe. When we look at those types of canisters and cartridges, we should make sure that it has a NIOSH approved label. These labels should not be removed. They should be clearly legible. They should be clearly marked NIOSH, and they should clearly identify an expiration date as well as clearly identify the type of filter material. Is it an N95 or is it a P100? Service life. This all depends upon the fact of how long you're using them, the amount of particulates that are in the air, in the environment that's there, and the specific type of filter material that's there. Some have an end of service life indicator. These warn you of the approach of the end of the adequate air respirator because the absorbent is saturated with material, or it may be that its shelf life has gone to a point to where the material is no longer capable of capturing the particulates that it's designed to do. Remember, at any time that you encounter an environment that you can't determine what the particulates are or whether the amount of oxygen that's in the air has this vapors or gases, you should automatically assume that that atmosphere is IDLH, immediately dangerous to life and health. And with that, there's only one type of respirator that's appropriate, and that's an atmospheric supply respirator. Again, the full-face SCBA, self-contained breathing apparatus, or a full-face regulator with an SAR, supplied air system. Before you choose which respirator that you're going to be wearing for the environment, you'll have to go through a physician or other licensed healthcare professional to determine whether you're medically capable of being able to work in an environment under respiratory protection. There's numerous different questions that they're going to ask under this program, but in this evaluation, you're going to be looking at the ability to use a respirator even before you can do fit testing or its use, There'll be follow-up medical examinations. We're going to be constantly looking at the fact of your health, smoking use, what kind of an atmosphere is it that you've been involved in, what kind of toxins you might have been around, other hazardous materials that you might have encountered. All these things will go into the health questionnaire that will be part of your annual health physical. Some of the things that we need to make sure is that you're reporting signs and symptoms of related to the use of your respirator, is that the physician, our occupational health physician, is looking at the fact of how you are medically at this time and making sure that you're sound to be able to work in those environments. We should be looking at the types of environments in which we expect you to go in and work in, as well as are you physically able to do the work in those environments. And any changes in the workplace or conditions that might substantially increase the psychological burden on you inside. Many people are claustrophobic, and when they've put on a full-face, tight-fitting respirator or an SCBA, it's a whole different world for them. So are you capable of working in an environment for a long period of time using our respiratory protection? If you're medically fit, then we're going to go through a fit testing process to make sure that any negative or positive pressure tight-fitting face pieces are actually providing you the seal that they need to protect your respiratory tract. When we look at a fit factor, this is a quantitative estimate of the amount of particulates in the air as well as what's inside the mask with you. The primary fit test method that we utilize for the Boone County Fire Protection District and Missouri Task Force 1 is a quantitative fit testing. With this, then we check the ambient air and the amount of particles that are in the air around you. At the same time, we check the air that's on the inside of the mask with you, making sure that those levels are vastly different. Particulates out in the air, clean air inside with you. Another test that's utilized is the qualitative fit test. We primarily don't use them much with the Boone County Fire Protection District or Missouri Task Force 1. But this test includes putting on your mask and then putting on a hood. We then provide either a very sweet smelling gas or a more bitter almond kind of scent inside the mask with you. With a properly fitted N95 mask, you should not be able to smell that very sweet smell or very bitter smell. If you do, then the mask is either not the right size for you, not properly fitted to your face, or there's something structurally with your face that's not allowing for a good seal with the mask. Anytime that you don a respirator of any type, you got to make sure you do a good seal check. Now, this is done by either an action of either a positive or negative pressure. With a positive, you're going to cover the exhalation port and blow. With that, then you make sure that you're not feeling any leak around the face piece itself. With a negative pressure, you're going to cover the inlets to the respirator and inhale. As you inhale, that creates a negative pressure, and you shouldn't feel any air leaking around the seal of the mask. If you wear glasses and you're wearing a full-face SCBA or full-face respirator, we will provide adapters that you can get your lenses fitted to and actually put on the inside with you. But they should not interfere with the face-to-face piece seal. Anytime that you don a tight-fitting respirator, you must perform a seal check each and every time. Facial hair or facial modifications or burns. No facial hair or anything that interferes with the sealing surface of the mask or face or valve function. If you've got a beard, it's got to be shaved. If you've modified your face, as seen in the center picture, or if you've suffered burns that don't allow for a smooth surface of the butyl rubber of the mask to seal against your face, then you may not be able to work in these environments with a tight-fitting respirator. We've got to constantly be making sure that the amount of degree of exposure, the surveillance or the working with the environments we're working in. Workers must leave the respirator use area to wash their face, wash their hands. If they detect vapors or gases, any kind of breakthrough in the seal of the mask, then you should automatically remove yourself from the environment. And then if you're going to replace the cartridge or canister or filtering device, remove yourself from the environment before replacing that. Anytime that you're wearing a issued full face or half face respirator, they can very easily be cleaned. You're going to use simple warm soapy water. You're not going to use a lot of hard bristles. You're not going to use any kind of acids. Just a simple soap and water. Wash them out very cleanly and rinse them off well, and allowing them to air dry. Annually, you'll have to sit through a training program and then go through a fit testing process as well. This information in part of the medical evaluation, of course, is all confidential. Therefore, you don't have to worry about the confidentiality of information that you give to our occupational health doctor. We'll record what size face piece that you wear. We'll make sure that we're looking at any kind of changes or alterations to your face, that we're providing you with a properly sealing mask. We got to be constantly looking at the masks itself and make sure that it's in still good working order and it still provides you with a good seal. Anytime that you're wearing a respirator, we've got to make sure that we're looking for signs and symptoms that may limit or prevent you from being able to effectively function in those areas. And then we've got to be looking at just overall general requirements of the workload. We've got to constantly be conducting evaluations of the workplace and making sure that the respirator that we walked into, does it still provide us with the right protection that we're going to need for the environments that we're working in. We're going to be constantly looking to our folks. Supervisors should be making sure that we've still got a good fit. We've got the right respirator selection, that we're properly using them, and that we properly maintained the respirators that we have. We're going to keep records. Annually, you have to do a fit test. If you're part of Missouri Task Force 1, you're going to fit test on the full face as well as the half face. If you're a member of the Boone County Fire Protection District, you're going to do a full face, and you're going to be quantitatively testing on the N95. We'll keep those records and retain them as part of your medical record. We'll make sure that we look at in this fit testing, this quantitative, we've got the records of not only the size of mask that you wore, but what the fit factor was at the time. And we'll provide you with a copy as well. There's really a couple different types of face pieces that are out there for us. There's the Scott AV 2000 and 3000. If you're a member of the Boone County Fire Protection District, you may still have a few AV 2000s out there. There may be a few 3000s. With Missouri Task Force 1, we've completely shifted over to the AV 3000 Sure Seal. There's several different components to the face pieces that we talked about. There's the adapters. The 40 millimeters, what was designed, shows here. We also have the 2-cartridge P100 that you'll find as part of the hazmat kit for Boone County Fire Protection District. You see an example of the eyeglass adapter that'll go inside a face piece, which we provide for you. Your respirators will take care of you if you take care of them. Before we can allow you to go into an environment wearing any kind of respirator, we've got to make sure that you've got the proper training and fit testing for that. If you have any questions about the respiratory protection, please contact any of the administrative members of Missouri Task Force 1 or the Boone County Fire Protection District. We'll simply ask you to take the quiz that follows this video. You don't have to do anything after that. Once you pass the quiz, it'll let you know that. It'll send you notification of that, and it'll send us a notification that you've passed the test. Again, thank you very much for taking the 2015 Respiratory Protection Training Program for the Boone County Fire Protection District and Missouri Task Force 1.